Health Secretary Francisco Duque III assured the public that the DOH remains transparent when it comes to giving information on the COVID-19 situation in the country. This in response to some errors pointed out by the UP COVID-19 pandemic response team when it comes to COVID patients' age, gender, residence, and health status, which were found in the April 24 and 25 data drops. For instance, a patient reported as dead on April 24 was no longer in the list of fatalities the next day. The experts are also questioning the continuing mismatch between the numbers provided by the DOH and the local government unit. For example, on May 3, DOH reported 7 deaths and 28 recoveries in Laguna, which was way lesser than that count of the provincial government. Duque said that these issues have been resolved as early as April 26.
The Department of Health appreciates the concerns raised by the UP COVID-19 pandemic response in its policy note number 6 dated May 8, 2020. Ang DOH po ay gumawa na po ng mga hakbang para po makorek itong mga tinatawag nilang data errors found in the April 24 and 25 data drops.
Hence, to minimize encoding errors, the DOH is now rolling out a new surveillance information system, COVID-Kaya, which automates several data collection processes.
We continuously rectify the data the moment we identify any issue. For example, inconsistencies in the formatting of the date, case classification, and proper identification of the location. Nevertheless, the DOH remains committed to transparency, and we welcome feedback from expert community.
Senate President Vicente Soto III said that providing inaccurate data, however small or big, the government is bound to make grave mistakes when it comes to crafting policies.
Hindi pwedeng sabihin maliit. Maliit ka, mali pa rin. Maliit o malaki, mali is mali. So kailangan ingat tayo dyan. Dapat the DOH should learn its lesson.
Secretary Duque, however, assured that these errors are just less than 1% of the whole data set and does not affect the government's interpretation and decision-making. Meanwhile, according to Stephanie C., founder and CEO of Thinking Machines and one of DOH's partners in data handling, there's no such thing as 100% correct data set in the real world, while their objective is to provide timely and useful data sets for policy-making.
There are checkpoints across the frontliners and with the DOH team, with the Thinking Machines data team, and also with public accountability. At every point, all of these stakeholders can check and figure out, is this an encoding issue? Sometimes it's an encoding issue, sometimes it's a process issue.
Meanwhile, 145 more patients have recovered, bringing the total number of recoveries to 2,251. 21 more have died, raising the death toll to 772, while COVID-19 cases climbed to 11,618 after the DOH recorded 268 new cases as of May 13. Mark Fetalco for The Nation.